This is your weekly budget brief from National Priorities Project. I'm Mattia Kramer. On November, the country heads to the polls. We'll elect a president, the entire U.S. House of Representatives, and 1/3 of the Senate. That's right, it's kind of a big deal. Now, a major election year issue is health care. It's been in the news a lot lately because of President Obama's health reform law, but another reason that it's an election season issue is because health care costs are eating up everyone's budget. So here are some fast facts on this issue and how President Obama and Governor Romney compare. First of all, healthcare accounts for nearly a quarter of the federal budget. So every time you hear about the U.S. government spending money, remember that about 25 cents on every dollar goes to healthcare. President Obama seeks to expand the Medicaid program, bringing millions of uninsured Americans into Medicaid. Anybody who's at or near the poverty line would qualify for Medicaid under the president's new health reform law. Because of the recent Supreme Court decision, states can choose whether or not to comply with this expansion of the Medicaid program, though most states have said they will. According to the Congressional Budget Office, President Obama's health reform law will reduce budget deficits by about $110 billion over the next decade, and about 1% of Americans will end up paying a penalty for not having health insurance. That's according to the Center on Budget and Policy Priorities in Washington. President Obama wants to drive down health care costs by changing the way the government pays for health care. See, right now the government pays for every medical test and procedure that doctors perform. But instead, President Obama proposes paying for performance, meaning that we'd only pay for quality care. Governor Romney supports a very different kind of health care reform. He's put his support behind a budget that passed the U.S. House back in March. It was introduced by Representative Paul Ryan of Wisconsin, and that budget would make deep cuts to the Medicaid program in order to save billions of dollars in the coming years. Medicaid is the health insurance program for low-income Americans. Now, we've got all the answers to your election season questions at our website in our Voter Guide 2012. Check out nationalpriorities.org.